Hello, everyone. Welcome to another Tuesday Late Night with Liz. I'm Liz. I'm a family nurse practitioner. Today, we're going to be talking all about trauma-informed care. And I have a wonderful, beautiful guest that's going to come on. Her name is Melody, and she is going to share all about her experience, but from a patient perspective. So I'm so grateful that we have her here because obviously my experience is from a provider. And I am going to share some things that I learned working through I attended like workshops on trauma informed care. I am in no way the expert. Okay. No way the expert, but I do have a few things that I used to try to put people at ease, right? Because this is something we really, I feel like, need to work on a lot better in healthcare. Because if you think about it, right? Trauma isn't just like physical, like, oh, I was physically necessarily harmed by healthcare. Trauma is anything that you have that you're walking into the situation with that makes things difficult for you, right? And I think a lot of us have that. A lot of us have not had the most perfect background with healthcare. And your relationship with your healthcare provider, like that really is a relationship. I was joking with Melody before that this is kind of, I feel like I'm doing like therapy for like your healthcare provider relationship, because last time we talked about what to do when you have a conflict with your healthcare provider. And then today we're kind of talking about like setting boundaries and sort of letting people know and having that vulnerability aspect so that the relationship can be really respectful, because you can have very like I don't mean like loving, but you know what I mean? Like very good healthcare after trauma. If people know how to actually help you with, like, actually are respectful of you and are working in that, and you are vulnerable in letting them, it's kind of a two-way street, right? You have to let them know that there's like you're sensitive there, and then they have to know how to kind of meet you. So today we're hopefully going to tackle both. I'll give some tips from the provider end, and then Melody's going to give some insights from a patient perspective that like she wishes people knew. And if any of you in the chat have anything to add to this, any discussion points, as always, we are here for respectful conversation. We're here for, if you don't agree, as long as you disagree respectfully, we are all ears. This is why we like to do these things. And hello, everyone in the chat. I appreciate you being here. If you are watching on the replay, there will be timestamps. That way, in case we get on a ramble, you can just like hop to the next massive point you want to hit. And without further ado, let us dive in. Let me find. I should have had this preloaded. Let me find. Yes. And it worked. I tried to make it so that Melody would be here when we got back. Okay, let us put names up so we have everyone. And then Melody, do you want to introduce yourself real quick to everyone, and then we will get started?
Sure. I'm Melody Nolan, and I live in the state of Wisconsin. I have a master's in counseling, but I've never been able to practice due to disability. And so now I'm just kind of an advocate for patients' rights, and my passion is being a client and an advocate for music therapy.
And we get her here. We are so very fortunate. Thank you so much for being here. I very much appreciate you. Melody's famous now. She was on TV. So she did a TV interview, which we're probably going to be reacting to live at some point, because I want more like patient input. And she talked about some great things on there. So we're probably going to be reacting to it live. She's a celebrity. Everyone say hello. You are meeting someone famous. So that's very exciting. Thank you, everyone in the chat, for the birthday wishes. It was my birthday yesterday. Lisa says, hello, Melody. Happy to see you again. Melody was here last Thursday, on our panel discussion. So yes, thank you. I am, hello. I'm 33. I gardened all day, which was excellent. That's exactly what I wanted to do. I got an Ember coffee mug. I don't have it up here, where it stays hot all the time, a mechanical keyboard, and a hammock. And it might have been my favorite combination of things ever. I was like, this is 33. We're doing the thing. Let me know your favorite birthday gift down below. It might be as an adult. I was going to say as an adult. I guess it could be as a child. Melody, do you have a favorite birthday gift you ever got? I know. It requires some serious pondering. Money? Yes. Okay. Yes. Everyone let us know. Money is never bad, because then you can do exactly whatever you want with it. And that is always a perfect answer. Hello, Sophia, Nurse Corky, Maricel. We're starting Lisa. We're getting like recurrent people that I'm like really recognizing. Spirit Media, Clayton, Sylvia. We need to come up with a nickname for you. Can we call you Silva? What can we call you? Clayton? Let me know, because that's a that's a mouthful. Unless you want to be called the whole thing, because absolutely you go if you want the whole thing. Hello, everyone. Welcome, welcome. Okay, so today there's a chat, there's a poll. Do you see my like ADHD brain is like bing, 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 bing. There's a poll asking if you are a healthcare provider. In the chat, you can find it, and it's going to ask if you received any like education on trauma informed care, because I really didn't. I think they like threw the word out there and they were like, go to a discussion board about it. Not very helpful, especially when this is such a huge component of like literally everything, right? Because the relationship you have with your healthcare provider, that is like everything. That is the whole point, is to build a relationship with someone so they trust you. And when you make recommendations or you talk about things or they come to you with questions, right, that they're going to believe you. Because I mean, I've seen my primary care provider once. If she told me something, I'd probably be like, yeah, like, okay, like take it or leave it, because I don't know her. There's no relationship there. Melody, is that something you kind of feel like you agree with? Like you definitely trust people more that you know, and they, you know, they listen and like all the things.
Yes.
Perfect. Perfect. I told her, I was like, just tell me if I'm totally off, because sometimes I way overthink things. Okay. So I'm going to start off real quick and just say a few things that I liked to do in order, in some difficult, not even difficult, like in situations where patients were coming to me and I knew that there was stuff going on, and also how I brought that up in conversation. And the goal of this being, whether you are a patient or a healthcare provider, to seek out, like if you're a patient, bring these things up and we can hopefully give you some tools to do this, or offer these things if you're a healthcare provider. And just know that if you have been through some really rough stuff that brings you into the healthcare space with misgivings, hesitancy, feeling nervous, know that there are people out there who do want to provide you with like care and will be compassionate and kind and get you there. We just have to find you them. Okay. And that's the key. But we are hopefully out there. I'm like lumping myself in. Hopefully I provide that. But I think people are out there and we want you to be able to access them. So advocating for these things is how we're going to get you there. So very first, I think if your healthcare provider is not, when you're meeting them for the first time, they should eventually be asking you a question like, is there anything else you need I should know about you? And if they're not, just bring it up. Be like, before we leave, I just wanted to mention. And this is a good place to just say any hesitancy you have going forward with your healthcare, right? Because the first part of this whole relationship is that vulnerability of you saying like, hey, I'm walking into this kind of with, I've been blown off before. We talked about kind of in the last episode that we can link below of what to do when you are feeling blown off by your healthcare provider. That's going to make you mistrustful of the system, right? Also, before I forget, there's probably a trigger warning in this whole video of just like hard things, right? Because feeling any kind of trauma coming into this, like that's what we're going to be talking about today. So if you just don't need to hear that and this is not the space for you, then we will see you in a funnier video next time, hopefully. But we are going to be talking about trauma and hard things and loss and just all of that. So just know that going forward. And we'll be using internet safe words because YouTube requires that, or they block your video. So that's not fun. So going in and having that, if you're a provider, saying, hey, what else should I know about you? I usually try to use the language of like healthcare. This is a relationship that I really value. I want you to feel comfortable asking me things and telling me things, knowing that like we're working together to get you to your healthcare goals. Is there anything that I should know about you, or that you want to like history of anything going on in healthcare where like things have not gone well and it makes you really nervous or uncomfortable about coming, like just talking about anything, kind of hopefully giving the floor back over to them to say like, hey, actually my previous provider was like a total a-hole and, never listened to me. Or, hey, I went in and I had this botched surgery and, this totally messed me up and I haven't sought medical care in 10 years. That's going to really kind of play into how you're saying things. And if you're a patient, it's hard to speak up in those moments, but before you get out of that room, the first time you're meeting a provider, be like, this is where I'm coming from, right? Because that's setting the whole appointment off on a totally different foot to kind of say like, if I seem really defensive, it's probably because no one's ever listened to me, or because someone cut the wrong finger off, or because someone went in and like, I was supposed to be having a mild bladder surgery and they nicked my gut and all this stuff happened. And I'm coming into this with a lot of nervousness and everything. So just having the vulnerability to kind of say that. And at the end of the visit is usually a good time for that. Hopefully they will be asking you, is there anything else you want me to tell you? And that's a great place there. The next thing in terms of making people feel comfortable in general, and Melody, you can tell me if this is helpful, is I always had my MA tell people when they were leaving, when she or he, they got them into the room and they were sitting them down, I would tell people to just sit wherever is the most comfortable for you. I never started a visit with like an exam. I find sitting on an exam table incredibly off-putting because like you're kind of up there as like a specimen. And I always just would tell them, like, have the MA just say, hey, sit wherever you are the most comfortable for. Like if I was doing like a pap smear or any kind of like routine gynecological thing, I wouldn't even necessarily, like, if they felt uncomfortable, be like, hey, if you're comfortable, here's the gown, you can sit wherever you want, like get dressed. If you aren't, just like chill, and then we'll come chat first, because it's really awkward to meet people for the first time when you're naked. And sometimes it's really awkward. Like if you have that 2 seconds, like I can go and chart for like a hot minute while you go and get naked. You know what I mean? Like after we've met and I've met you with clothes on, which just feels like a much more normal way to meet people. I had people who, even when I had known them for years, they just wanted to say hi first and go over maybe their, like, all the questions, because you ask 8 million questions while they're wearing clothes, because it's so much more of a normal way to like meet people and have them feel more comfortable. And then kind of just judging, like a lot of people did sit in a chair, and you could do almost all of the exam with them sitting there in a chair next to them. If you're showing them things, ask like, hey, can I sit next to you? Just ask. I found that asking people where their personal bubble was very helpful. Just go in and be like, hey, you're sitting there. Like, do you mind if I sit here next to you? They can say no. Do you want me to sit over here? I used to just sit on my little rolling chair, and that gave me a lot of flexibility to be able to roll right up if all of a sudden they started to get like emotional, and I could scooch them over and hand them a tissue box. Or like if you know them better, like, and you're going to like go over and kind of just like give them a hug or sit there with them, a lot more flexibility. But just asking, like, can I come over and give you a hug? Can I do this? And reading the room, because some people are going to be like, please don't touch me. But just like asking, you know what I mean? In general, also ask before you touch people. That's like weird, right? In healthcare, we kind of expect that I'm going to come into your bubble, and like it's so normal that like we touch people all over every day, all the time, but you have no idea like what that person's really like, how they might have been touched before, who has come in and not asked them to touch them and then things did not go well. Always just ask. Even for like when I would listen with my like stethoscope, can I listen to you? Can I listen to your lungs? And tell them what you're going to do, where you're going to touch, what it's going to feel like. Hey, I'm going to push around on your belly. I'm looking to see if I can feel any hard bumps or lumps. Hey, I am going to be, like whacking your, like doing something like trying to see if you have a reflex in your elbow. Like, I'm going to be doing this, just asking like every step of the way, can I touch you here? Perfect. Pelvic exams is a very good way, like also something to just kind of ask around a lot. And I guess before we go into pelvic exams, if you are a patient in this situation where you want to be touched, just say, like, can you ask me before you touch me? This would be a good place to be like, hey, I have been this could be, and it doesn't have to be just in healthcare. Like maybe you're someone with a history of like SA and you have been touched inappropriately by people that you did not want to be touched by. So like that is a huge thing for you, right? Just say like, I would really appreciate it if you would ask before you just like come in my bubble. You don't even have to say touch me, but just like, hey, I have a personal space thing. Can you just ask before you come into my bubble? And like that kind of puts you on like, oh, yep, like sorry. And that's a kind of a nicer, like a gentler way. If you want to be more gentle, you don't have to be like, don't touch me without asking. Just if you want to come in my bubble, just like ask. And also know with pelvic exams specifically, or any kind of exam of a sensitive area, right? Typically, I think of pelvic exams with this. I've taken care of a lot of people with a lot of trauma surrounding pelvic exams, either that they were horribly painful, that they have had some kind of like abuse in the past, that they have had really negative experiences in healthcare, either through childbirth or through past pap smears. Like we used to do these types of exams on people who were much younger, because the rule was either when you're sexually active or when you're 18. And now it's like when you're 25. So young girls, young people were having pelvic exams, and there was a lot of trauma surrounding that. And going into these, I always ask, and I highly recommend if you're a patient to just kind of say, again, in the perfect world, your provider would ask before, when we're still chatting, when you have your clothes on, I usually just ask and recommend all the students I precepted to just ask and say, hey, these exams are very intimate. I understand that they can be pretty uncomfortable for you. Do you have anything that just makes you really nervous, uncomfortable, or like big feelings surrounding these, right? And just say, come out with it that it's awkward for them. Don't say it's not, hopefully it's not awkward. I mean, in the beginning it might be awkward for you, but then you've done a million of them and you're like, oh, it just an elbow, a cervix, it's all the same thing in my mind. Like, going into it and acknowledging that, and hopefully they will trust you enough to tell you, right? And be like, hey, this is something that is like, I've had this going on, and then you can troubleshoot from there. And throughout the entire exam, again, letting them know, hey, I'm touching, I'm going to place my fingers right here. I'm going to do this. I'm going to this. And I also always told my patients, specifically with any exam really, but really with these is, we have words that we would set up before, and I would say hey, this was with everyone, when you're having a pelvic exam, this, like I said, can be uncomfortable. I want you to have certain words so that we have a good communication. If you say stop, I'm going to stop, but I'm not going to withdraw my hand, because sometimes that can actually be painful, is to remove everything and get your hand out of there. So if you say stop, I'm going to freeze. And if you say I'm done or just done, I'm out. So those are kind of the two things. So establishing words with your patient of, this is what we're going to do if things go south. And I don't question it. If you say, ow, I'll check in with you and be like, what do you want me to do? Freeze, done, what do you want? But having those words spoken beforehand can be super helpful. If someone's really sensitive about if they're a lot of stress, anxiety, concern, you can send them home with a speculum. I always show people what a speculum is beforehand, and I show them how it clicks, because the number of people who are having some of their first pelvic exams that do not know, if you're using a plastic one that goes when you click down, we play with it first. We just bring it out. I'm like, this is what it does. It's going in there. You have your cervix, talking through the whole thing, explaining what it is. Let them hold it. Let them feel it. If they're really nervous, I send them home with it. I'm like, there you go. You want to do that and go see what it feels like when it's you have it. They can insert it themselves. If that's what they want. You don't have to use stirrups if they don't want. If they're not using stirrups, put a blanket under their butt, and that's going to help open things out a lot more. And it's going to just simple things like that of, hey, how do you want to do this? What would make you feel the most comfortable? And always remembering that for some people, the exams that we do are more harmful than the potential the gain of it, and not pushing it, right? I've had plenty of patients who came in and said, I do not want a pelvic, I do not care. I do not want a cervical screening. And that first year I was like, okay, I do have to, that's totally fine. This test for this, I'm just going to tell you what this kind of test for. And there's a risk that you might have this and we might miss it. But if this is worse for you, then that's totally fine. And over the years, almost all of them, by the time I'd known them for 3 years, they came in and we eventually did it, because they trusted me at that point, because this is a relationship. But not pushing people or withholding birth control. We should have a whole chat on that one day, because the number of people who have been withheld birth control because they would not have a stupid pap smear is mind blowing. But I think those are my big ones. Just being very respectful of anything that patients are coming to you with, and understanding that it might not have anything to do with healthcare, or it might be something that you don't see as a big deal, but to them it was huge, because our perception is really warped. We think big deal death, and other people, they think, I prepared for this appointment for 3 months, and then you came in, you spent 2 minutes with me, and you kind of blew me off. And that was, really harmful. So just valuing everyone's experience, and then kind of going forward. You know what I mean? Listening to people, always asking to go into their bubble, asking more questions, just trying to be a human to them instead of someone else. Okay, that was a lot of me talking. Let me get some comments, and then Melody will kind of hand it over to you, and we'll get some of your thoughts and see if that seemed semi on track, and then what you would add, and going forward. Trisha Jackson said, man, speaking of respectful of patients, when I found out I was pregnant, I called our local hospital to ask about my options, like birthing positions, birthing tubs, etc. And I immediately got accused of being a baby killer. They don't want to do that thing here. And I got hung up on. Yeah, that's awful. And talk about people jumping to assumptions. Yikers. Yikers. I am sorry. Mama nurse said, Liz, that's smart. Oh, thanks. Like at the dentist, she always says, if you want me to stop for any reason, raise your left hand. Very reassuring. Yeah. And giving people language beforehand, like just makes it so much better. Oh, good. Clayton. Call me Clayton. Thank you. Perfect. So agree. Respect means so much. I took my mom because she was having a whole body shakes and the provider said my 66-year-old mom was faking it. Oh, that's so ridiculous. Yeah. And that's just find a new one. Find a new one, friends. Or say like, what, go back to our last video. Why aren't you worried? What about this doesn't make you worried? Yeah, I actually, I care out loud, hoping that it helps patients know exactly what's coming. Exactly. I love this method of just, I'm going to talk you through it. And I tell them that you can tell me to be quiet. I'm like, you can tell me to shut up if you want to, but if I'm just going to talk you through this exact process so you know exactly what's happening. And anytime we're going to escalate anything, like, hey, let's do this. But just listening and being respectful. Lisa said, I once had a young teen patient who came in the ER with a lost tampon string. Oh man, the poor young people, especially young people. I've had so many people come in with lost tampons. But especially the young people, they're so embarrassed. I looked at the clock, realized the doc on call would not be on call in 15 minutes, and he was rarely appropriate. Yikes. I waited 15 minutes to call the other doc. Yes, sometimes that's very helpful. And especially if you're triaging people, send them like, get to know, you'll get to know your people and just send them to the people who are nice. You know what I mean? Who are going to be good with the 15-year-old who accidentally like completely lost the tampon string and thinks it's the most embarrassing thing that has definitely happened to any human on the entire world ever. You know what I mean? And like get the one who's going to be in there and be like, okay, like who among us has not done this? Let's go search. Mama nurse said, I had a patient warn me not to stand by him while he was sleeping. He said from past trauma, he wakes up very startled. He said he once flipped his daughter across the bed for not knowing it was her. Yes, I'm so glad you brought this up because I was going to talk about when you're a nurse or anyone dealing with sleeping people, ask them before they go to bed. How do you want me to wake you up? Because they're going to either be like, I want you to stand at the foot of my bed and be like, Melissa, like, wake up, Melissa. Like, you know what I mean? Like poking you with, I don't know, whatever. Or is it okay to come up and like gently be like, hey, I really need to stab you right now. Like, wake up. It's time for your stupid heparin. Just ask people because I have also been clocked by someone who I came up and just ever so gently laid my hand on like I didn't even touch them. I laid it on like the handrail. It didn't go well because it was someone who had he was a vet and he had been like in war and like the sounds and the waking up in terrible ways. So yes. Morgan Westfall said, I had a very traumatic childbirth. I'm so sorry. Oh, that makes me so sad. This means a lot. I hope you have providers that are very respectful of that. I had a very traumatic first childbirth. So I'm very appreciative of all the people afterwards who really helped like mend that fence. And we're very understanding of that and didn't push for things. Lisa said, I ask before every touch. I like that method. I ask before I take a blood pressure. I ask every step of an assessment, even with my elderly dementia patients, for sure. Especially with elderly dementia patients. Red Gun 48 said, currently in nursing school, direct entry MSN. My program greatly emphasized trauma-informed care. Yay! I hope they give you like strategies and all of that to go with it. That would be perfect. Also, I see this comment, Joyful Goats Farm and Wellness. My favorite birthday was when my mom got me chickens when I was joking about wanting them chickens a few days before my birthday, but thought I was serious. Forever grateful for them. This is my dream for 34. We're not supposed to have chickens in our neighborhood, but I have this pocket of woods that I think if I just plant trees in front of, who's going to know? Who's going to know if I have chickens? And my neighbors are fine with it, at least the ones that live here so far. So I seem to think that this is going to be totally, totally fine. And there we go. Nurse Scott, welcome. We are talking about trauma-informed care and some methods for how to either advocate for it from a patient perspective or for providers to kind of bring it up and hopefully just show that you can get really compassionate, kind healthcare following in the healthcare system, even if your experience with it or experience in life in general has not been the absolute best, because it is exist out there. Nurse Adrian, hello. These are all of our Thursday panel people. Thanks, Liz. Thanks for being here. Thanks, Liz, for bringing light to this. These topics are needed in nursing school and advanced practice training. Yes, I did not receive any of it. So that's why I'm like, what on earth? This is what on earth? Let me see. Perfect. And trauma-informed care, empathy, and compassion would be great mandatory subjects for CEUs for nurses and providers. Exactly. So, in case you aren't familiar, nurses, every pretty much healthcare provider, do you have to do like CEUs, Melody?
Well, I'm not practicing, so
But
no. But yes,
yeah.
Therapists do need to do that in order to keep their licenses current.
I feel like pretty much every licensed healthcare person has to do continuing education credits, and this would be a great one. Sometimes they mandate weird ones. I guess not weird, but ones where you're kind of like, really? And this would be a great one of just like basic trauma-informed care would be very, very helpful. Sophia said, good idea. I never got asked before my wisdom tooth removal surgery. What? What didn't you get asked? Because that seems insane. With whatever happened. Let me see. No, Nurse Scott says, no, I'm advising the patient to ask, what am I missing here? Oh, yes. Thank you. Once again, late end of the day, Tuesdays. I like our Tuesday night streams, but most things just go right over my head. Potty training, a toddler, all of my brain cells, absolutely all of my brain cells gone. All right, Melody.
Yes.
I'm handing it over after my epic soliloquy to you. I'm going to go close the poll. Thoughts so far? And then if you want to share your experience, whatever you feel kind of comfortable with, just kind of from a patient perspective and things that you wish people considered and advice for other patients of how to speak up.
Okay.
If you have it.
All right. Well, thank you for having me. And I just want to say hello to everyone in the chat. And thank you to those who said hello to me. I didn't want to interrupt, but I did see you, and I appreciate that very much. And to the members of the panel that are here that I was on with last time, thank you for the warm welcome, because it's a little bit nerve-wracking to go in and be the only patient with a bunch of nurses and medical practitioners. So
we appreciate you for doing
thank
it.
You all
I know that can't be.
much.
I know that cannot be easy.
Yeah.
Especially when you have people like Scott who are just so intimidating and mean. And it's just.
Well, let's see. I guess if you don't mind, I'll start with kind of how we came up with this topic. I was tuning into one of Nurse Liz's broadcasts, and with all the things going on in the news, it was around the time, I think, of the Redonda Vought trial. She was pretty distraught. And I just sort of typed in the chat, hey, would you like to hear of a positive experience? and she was like, yeah. So anyway, that led to me telling her what I will now share with you. And it led to this podcast, which is really cool. So I actually so I do have PTSD. I've had it forever, pretty much, because my trauma started when I was young. I won't go into detail about that, but I was in foster care, if that tells you all that you need to know. So that has been something that I have always dealt with, along with my medical issues. So this talk means a lot to me. But anyway, I had never really thought about it in the way that I do now until it was the end of May, when it just seems like when it rains, it pours. But anyway, on top of everything else that I had going on, I went to the ER. Long story short, I had a gallstone in a duct that had to come out, and the gallbladder had to come out, and there was no surgeon available in the area. So they had to transport me an hour and a half away to a city that I've never been to before. and a hospital I've been to before where no friends could bring me anything, and all I had was the clothes on my back and my purse, right? So I was not in very good I was not happy when I got there. But anyway, one of the surgeons came in to talk to me because there were 2 separate surgeries, and she said, so I've been looking through your chart and I see that you have PTSD. And I immediately was like, oh no, here it goes. This pain is all in your head. You don't really need surgery. They made a mistake. Go home. That's
and is that because you had heard that before?
Yeah, that's a whole other story, but yes.
Yeah.
And so that's what I was expecting. And instead, she said, no, I want to talk to you about the procedure of the surgery that I'm going to do to see if there's anything that is going to trigger you. And I almost fell out of bed. I was so shocked. I was just like, well, thank you. I really, you can tell I'm not one who's usually lost for words, but I was pretty speechless. So, and grateful. So she advised me that before she put me out in the anesthesia, she was going to have to restrain my arms. And she was like, so is this something you want to talk about? And I'm like, well, in my case, just knowing it ahead of time helps. Just the fact that we're having this conversation, I'm so blown away that I now trust you completely. So you can do whatever you want, was how I went. And I asked her, I'm like, what led you to have this conversation with me? And it's the same thing that actually you just mentioned, Nurse Liz. She had worked a lot with veterans with PTSD. And she told me some stories that were pretty frightening. But anyway, so this whole issue, my having the opportunity now to address this issue actually came from an expression of gratitude for the way that I was treated.
Yeah. And I love that. Yeah. And we're hoping to change it so that it's not you falling out of your chair when someone says, is there a way I can respectfully treat your body? You know what I mean?
Right.
Like, so that this is just a normal question when you're about to go be with someone who's unconscious. You know what I mean? Like, so I love that.
Yeah.
Oh, I love that. And then have you told her like that she's you appreciated that?
Oh, yes. And I sent her a thank you note. I sent her recordings of my music therapy.
I love that. That probably made her day. You know what I mean? I love that. I love that.
And then when I had to go back because the stent didn't come out on its own like it was supposed to, I talked to the head of the surgery department and told her the whole story. So I just telling everybody I can. I'm like, this is appreciated. It might seem like a small thing or a routine thing, but it's huge.
And that's the thing. It's like a huge,
And I don't really know the current statistics on crime, but I think most of us have had something happen to us at some point that I think that this is a relevant topic to nearly everyone. This isn't just like a small segment of the population that we're talking about,
Yep.
So I do have a question. Do we have any EMTs out there? Anyone who works with the ambulance or anything? Okay.
Well, we'll let people gain courage to chime in.
Right.
I'm sure someone out there does, or at least on the replay, there will be plenty of people.
Maybe on the replay. Okay. So this is a key situation because when you are being transported in an ambulance, what happens? You are laying down, you are restrained, and sometimes you have an IV or something else put in on you. You have no control. You can't see where you're going. At least my experience is usually I'm a woman in there with 3 men. Talk about triggering. And I would really like for EMTs to just to introduce themselves. I realize that if you're dying, they don't necessarily have time to sit there and talk to you, but just as able, and my name is so-and-so and da-da-da-da, and we're going to put you on the gurney, and now I need to put this on because it's a seatbelt, and, you're safe, or just go ahead and assume the person has trauma issues and talk them through it the best you can.
Yep.
I would highly appreciate that. I actually had an experience where I was bullied in an ambulance.
Oh my
And
gosh.
they were threatening to turn around and take me home if I didn't apologize, because I got upset because the driver was saying that he was drunk and that for some reason we didn't have enough oxygen, and I couldn't figure out if he was joking or not. And so I think I swore, which I usually don't, but I was in a lot of pain. And then they were like, "You apologize right now to my buddy. Da, 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 da. If you don't apologize, we're going to pull you over and drop you off on the side of the street right now." Da, 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 da. And I'm like trapped in there with these.
Oh,
I was so scared I couldn't apologize.
oh my
So,
gosh.
I mean,
That's so inappropriate.
yeah, these things do happen. And I have a close friend who has a significant number of medical issues too. And I had never even heard the term medical PTSD before until I met her. And then you were talking about that, and some of the people in the chat, talking about the experiences in the childbirth and being transferred and whatever, that it's just like, it's all too common to have that trauma. But like you're saying, let's make it so that the conversation is not uncommon. So I guess I would just encourage people overall, and I love all of Nurse Liz's suggestions, and I'm kind of like, can you move here so you could be my nurse practitioner?
Really the reason I brought you on here tonight was
as well as some of you in the chat, I would love to have as well. But there is a fear, at least among the people that I've talked to, of discussing your mental health issues with your other providers, and because they're afraid of being discounted. I know what it feels like to be discounted. I had severe abdominal pain in my early 20s, went on and on and on. I kept being told it was psychosomatic. Okay. Well, eventually it turned out I had a 6-inch, 9-pound tumor that needed to be removed. And when I woke up from the surgery, I had had a hysterectomy to which I had never consented. Wow. So the not being heard has consequences. The tumors grow. I mean, just because someone doesn't believe it's there doesn't mean that it's not. So we need to learn, the providers need to learn how to listen to us. And as patients, we need to learn how to talk to them. And that's what that last video was about, was to say, hey, wait, I'm sorry, and like Nurse Liz suggested in regard to a different issue, as a result of listening to her, I came up with the phrase, okay, so if I did not have mental health issues, then how would you be seeing my condition and my symptoms right now?
I love that.
And I think that's well, you inspired it. So.
Well, yeah, and that one was about like, if
if you're overweight.
Yes. If I was not like sitting, if I weighed, what if I weighed 120 pounds? How would you work it out just to get people out of their head? Cause I completely agree. I've seen so many people blown off where they're like, oh, well, but they're, you kind of exit a room and they're like, but she's bipolar. And then you keep moving on. You know what I mean? Like, and this was like in my preceptorships and in the hospital where you'd be like, okay, your belly pain. Yep. Walk out of the room and they're like, and you're like, okay, so what are we going to do? And they're like, well, she has a lot of psych stuff. So we're probably just going to call them. And it's like,
and
yeah,
you are not mutually exclusive.
Exactly. This is not an or situation. Your body's not like, actually, we have a lot going on psychologically. So the rest of us will not fail. We've got, like pick one. And that's just not how it is. So I'm really glad you brought that up. Do you have...
That's why I find that it's actually helpful to own it, because that way I take control of that conversation and I'm not just leaving that doctor to whatever little notes they've had privy to make whatever assumptions that they want on their own. So, and I know now it seems like every time I go to the doctor, there's also a mental health screening. And I know I always fail those, and I'm always like, I always say, no, I can't do this, or yes, I have this symptom and I'm in treatment with so-and-so, I'm on medication and this is what we're doing. So you don't need to worry about that. Then they say, okay. So I'm just very open about it. but sometimes it gets kind of humorous. I have a funny story.
We need one. That sounds
I was
good.
pretty sick about, I don't know, I'm bad with time. So maybe like 2 years ago. And I needed a hospital bed because I kept falling out of bed. And so I was so nervous about asking for this. And I went into my primary care, who at that time was relatively new to me. And so she knows that I have anxiety issues and PTSD issues, but I was so nervous. I was so nervous. And so even though I had, written everything down and taken my notes and rehearsed it out loud and everything, I didn't take any of my own advice. And I walked in and I said, and I sat there and I just stared at her and I stared at her and I stared at her and I looked down and I go, I'm afraid for my safety. Oh no, that's not what I mean. That's not what I mean. I'm okay. I'm not suicidal. Then I completely freaked out and had to walk back the whole statement. And bless her heart, she didn't say a word. She just sat there and just waited for me to get over my little tantrum and was just kind of like, okay, what are you afraid is going to happen? And I'm like, I'm afraid I'm going to fall out of bed.
Yeah. Yeah. You're like, but I completely understand. I too have, yes.
Yeah. So I just think taking control of that conversation is important, because otherwise your providers can't consider what they don't know. And so that is our responsibility to inform them. And if they react in such a way of like, oh, well, then that explains everything or whatever, fire them. You know, I mean, they're just not the right one for you. And you remember that? Hi, Anna. Sorry, I have a friend in the chat here. I mean, live. Right. And the one place where I find that it is absolutely essential is that I haven't really talked about this with many people. Do you guys have mental health side effects to medications?
Yes.
Because that is not discussed enough. And
no.
Yes. And so that is why, like, I'm that way with steroids. I cannot take steroids for more than 6 days or I get suicidal.
And you're like, that's a good thing to avoid. Let's not.
And I will tell my doctor that. And this happened even again. And he was like, okay, well, let's just try it and see what happens. And I'm like, okay, but the day that I call your office and I tell you I'm suicidal, you better take me off this.
Yeah.
And lo and behold, I think maybe it was day 7 or 8, because he wanted me on it for a month until something else kicked in. I was just like, no. I was just like, no. And why didn't you listen to me the first time? Why did I have to go through this? So it's just.
And that is, that is so hard. Yeah. And you're like, why do we have to fight this entire battle? Just listen to me. Understand that I know my body. And like, here we go. Like, why is this so hard? On a very similar, ironically note, I have horrible poison ivy right now all over my body. And I told my person, I was on like a teledoc appointment today. And I was like, do not put me on steroids. I was like, I understand that I probably should be on them. Okay. I understand that. I was like, but I don't do well. I don't go down into the that like permanent exit strategy route that Melody you were talking about, but I can't function. I'm like a angry hornet of anxiety stress ball. So like, it's not working.
I apologize. I used that word.
Oh, you're fine. You're totally fine. And like, they were totally fine with it. And it was so refreshing. They were like, oh yeah, that sounds really bad. So let's do this. And if this doesn't work, you might end up having to do that anyway. But like, hey, like, it's fine. We can try that first. Is it the best? No, but like, let's just try it. And it was so nice because I was so prepared for a fight. Like you said, like, we're so expectant that like people won't respect that boundary, which is ridiculous. And so there's another positive story for once in my life, a positive story. Poor Melody's like, can I just please have a good story? I'd love to share a good story on your channel. I'm feeling a lot of your steroid-induced rage without the steroids. It's not all bad. I'm like, yes, only
now
bad.
that I think about it, I'm always the one now that asks my doctor, does this medication have any mental health side effects. They never bring that up when they say, watch for this if you become dizzy, lightheaded, fast heart rate, et cetera, et cetera. They never say if you start noticing a weird change in mood or agitation or anything, that could be related. And I think that's something
Yeah.
that needs to be done regularly as well.
Absolutely.
Yeah.
Absolutely. I did always try to give. I feel like that's a very good point and we're not really taught a lot of the psychological, like the mental health side effects of things. I'm trying to think back, like that's just not something that's horribly pushed on. Like a lot of psych meds, they will in the initial period, there's warnings that come with them and we're usually pretty good about that. But like steroids, it took me a little while to have people coming back and being like, don't ever put me on those again. My family wants to murder me because I was so mean. For me to then be like, hey, you need, like, if we're going to do these, like, you're going to be real mean. You might be real mean. You might be agitated. You might be like wound up like a little ball. So just warn your family preemptively. You know what I mean? Like, I'm going to be real something. Like, so we're all going to go in with our eyes wide open and, we're just going to go. But like, yeah, including that into the conversation would be so, so helpful. Do you have tips for how to, if you are not as familiar with like, having to like advocate for yourself, what, how to like get that point across if someone is just scared and they're like, I don't even want to open my mouth because it has never been well received before for me to even try to advocate. Like, how could you even go about being like, hey, I have a lot of like anxiety, stress, PTSD, like surrounding this, like what's a good way to get that out?
Usually I'm an advocate if you can manage to get it out, or as you recommended in a previous video, write it on a sheet of paper and hand it to them. I'm just saying, I need to tell you something so that you can effectively manage my care, but I'm really scared too, or something. And it's making me really nervous, and I've never had anyone dismiss that. That they always want to know, okay, well, then what is it? And then it can just kind of be like, okay, well, you probably see in my chart that I have depression and anxiety and PTSD. Well, this exam that we're about to have is going to be really hard on me because of that.
Yeah. Yeah.
Or I have, or some, I don't have this, but some people, especially like if as part of their trauma, they were drugged or something, they might be very afraid of needles and IVs and vaccinations or whatever. And just to let them know that, and so it would be helpful to me. Like, don't tell me before you poke me, for example, because I'm just sitting here being afraid of when you're going to say it. And, I'm just, whatever it is, just work with me. I also, because music is my main coping skill, if I'm really nervous, I'll play calming music, and then I ask the doctor if we can keep it on during the session.
I love that.
Yeah, and that helps. But really just to try to be as specific as I can without, and I'll say, look, I am addressing this in therapy, so you don't need to worry about that. However, this is impacting what we need to do. And so I need to talk about this so that I don't get scared and run out of here, and forget to put my clothes on first,
Yeah, exactly. Yeah, exactly. Exactly. Like, and I think that's super helpful of just like, of ways that you actually can speak up, you know what I mean? Starting the conversation with just like, I'm nervous. Because I think you're right that most decent healthcare providers, even if you get out the words like, I'm nervous or like, you can usually look and people are sitting there like, they look very uncomfortable and just like asking like, something about this seems like it's not sitting super good. Like, just tell me. So if you are a patient and you can get like any words out of just like, I don't like this, like anything like that, and then I think that's usually any decent human is going to be able to dive into it. Or Nurse Scott said, bring someone with you. If you have a friend, anyone who cares for you, or even like your willing neighbor, you know what I mean? Who's and go in. I have many times been the person who someone's like, I'm like, I will go and I will like, if you can't say it, I will. You know what I mean? Not that you're bulldozing the appointment. I know last time we talked about, or one time recently, we talked about like a lot of people don't like having other people there, but I think it can make a huge difference if you have someone else there to advocate and be like, what are you're nervous about this, aren't you? Like, did you want to bring that up? Just introducing it, not explaining it for someone, but having that person to be like, hey, don't forget to bring this point up. You know what I mean? Like, so any word vomit you can get out that involves the word nervous or like anything.
Right.
Hopefully,
Well,
should have someone pick it up.
and hopefully, if you have a mental health condition, and if you have a chronic illness, you likely do because it's hard to live with chronic illness. You can also address the anxiety about the medical care with your mental health care practitioner. I have this appointment on Tuesday with Dr. So-and-so and whatever, or like, and you could do, for example, EMDR or some type of desensitization exercises. Bring in a syringe and be like, I'm scared of needles, and just work with the therapist with it. And
yep,
like you were saying with the speculum, that would be an interesting therapy session.
Yeah.
But but I'm scared of this, and I'm also a big fan of role playing. Best case scenario and worst case scenario, and switching. I'm like, okay, you be me, and I'm going to be like I'm going to tell you everything that I fear the doctor is going to say.
Yeah.
And you, therapist, respond.
Oh, that's really good. Yeah, to just kind of give you examples.
Yes. Mm-hmm.
Yeah. I love that. That's a really good point. That's really good. Also, your laugh is just joyful, if no one's ever told you that.
Oh, thank
it's
you.
Like my favorite.
I'm
like sitting here.
I'm nervous and I feel like I'm talking too fast. But
oh no, you're doing perfect. I was just thinking. I was like, Anna, I'm sort of jealous that you get to be friends because that would be an excellent laugh to just hear throughout your life. I'm like, it's so
she
nice.
helps me laugh. We laugh about all this stuff.
I love that. You need someone to do that and just like laugh about dark things. Where you're like, I'm choosing that it's funny today. It's not always going to be funny, but today we're just going to choose that it's funny. Okay.
Exactly.
Laugh about these wacky things. Let me go back. Anything else? Oh, and I did want to say with your mental health thing, like, yes. And I've had a lot of people that will be like, oh, well, she's just anxious. Like she has anxiety. And that's not like like they'll just throw it off as like, okay, well then we'll disregard it. And I'm glad you brought that up because it's like, yes. So we should accommodate that. Exactly. So yes, they have anxiety. And do you not think that this stressful procedure might heighten said anxiety? Like rather than being like, well, she's anxious, write it off as like, well, that's just an anxious person. Like maybe we should just address it and work with it rather than being like, meh, like what? Or, oh, they're depressed. They don't want to do it. Like they're not going to follow through with any of the treatment. Okay, so what are we going to do about it, friend? Like we have this going into it, so we know about it and let's do something about it. And you can always bring that up too in your pre-treatment thing. If you're going to be going through something that's going to make you immobile or more anxious, like Melody said, just bringing it up and being like, hey, I am well aware that I am at baseline, like an anxious human. Okay. Like this is probably going to make this worse. What's our plan going forward? Right. That is also trauma informed care of saying like, hey, we have a combination here of, I have a history of this. This is going to make it worse. What are we going to do going forward? Because again, trauma doesn't all look the same. You might just be very anxious or depressed or something like that. And that's a very normal, that's totally okay to just say that, hey, I'm having a hip replacement. I have had some really brave people be like, I am having a hip replacement. I'm very active. If this, like when I'm stuck at home, I'm worried my depression is going to spiral. And then we can come up with a game plan of like, hey, this is what we're going to do. You know what I mean? Going into it. So I'm really glad you brought that up because it's not like you said, it's an and you're like, like, okay. If I said, hey, you have this and you also have heart disease. So I guess, well, you're just going to die. Like that's weird. But all of a sudden, you know what I mean? If you're like, well, you have this and anxiety and we're like, well, like, oh, what are you going to do? Like, it's very odd that we treat it like that. And it makes absolutely no sense, especially in the world. Like, I feel like right now there's so much, we're required to do so many things that a lot of people are having mental health struggles. So this is not something that should be shocking to anyone. Yet everyone is surprised and constantly like, oh, well, they have anxiety. I'm like, well, who doesn't? But
Right.
why
But
have
I think
how
sometimes as a result of that, it gets
like no,
minimized.
that's a very good point. That's a very good
That
point of
people's,
like,
oh,
oh,
well, we're
well,
all stressed these days with
that's
everything
a
going
very
on in
good
the
point.
world. And like, we're
Yep.
all stressed. I'm like, okay, I'm talking about clinical anxiety.
I'm glad you brought that up. Yeah.
Yeah.
That's a very good point of, yeah. Then everyone's like, oh, well, I have anxiety too.
Right.
And it's like, well, yes. And here's mine.
Right.
And what are we
like,
going to
well,
do?
what do you mean when you say that? Because when I say that, I'm talking about this is like disruptive,
Mm-hmm. Yeah. I'm glad you brought that up.
Treatment.
Yeah.
Same with depression, the same thing. People are like, well, the world's depressing. Yeah. But there's depression. I guess, I don't know if it's technically an emotion or not, but I'll call it one. And then there's depression, the clinical condition that needs treatment,
Yeah. Yeah. I'm glad you brought that up because, yeah, minimizing it is never, ever helpful at all. And that definitely can come off sounding minimizing, if you're just like, oh, well, everyone has that. We'll just deal with it. Sophia's right, exactly. I despise going to the doctor. I'd rather go to the dentist anyway, because someone was saying the dentist listens better. And this is what I think, like, this is kind of a very benign thing, like a benign example of like most people are walking into healthcare with trauma. Like, you despise going to the doctor. Like, that would be something where we look and we're like, why? Like, why do you hate it? This should be a relationship that you like trust. You know what I mean? There's probably something there that happened in the past that now you're walking into this situation not liking it because of things that have happened before. And I think most of us, if we're being honest, probably have like, you know, if you just put like a me or something in the chat, like most of us have probably had negative healthcare experiences that make us not want to go back, you know what I mean, or be receptive to things. Also, Sophia, thanks for being a channel member. You to bomb. But you know what I mean? Like, it's not rare. And I think when we hear, oh, like trauma-informed care, you think of, I mean, situations like yours, Melody, where it's like, I wasn't listened to you, and then things got so bad, and then you took my uterus out. Like, extreme. Like, that is bad. That is bad. Very obviously like trauma. But then there's a lot of people who have been blown off or weren't listened to, or were told, well, why don't you just lose weight? Like, all of your problems are related to your weight. And that can be also very damaging in dealing with the healthcare system and creates a huge barrier, destroys that trust. And if you don't trust your healthcare provider, what's the point? You know what I mean? Like, that's not what we want here. So hopefully some of these tips have helped you guys figure.
I have a couple more thoughts.
Oh, yes, please. I wasn't wrapping up. Don't worry. I was just doing a mid-chat wrap-up. More thoughts. Always welcome.
I was just thinking about what makes going to the doctor so intimidating for so many people, myself included. And I think that a lot of times it has to do with whatever kind of messages we got when we were young and when we were sick. I mean, I think a lot of us were told, don't complain. So you go to the doctor, what are you doing? You're essentially complaining. So, don't complain, or you're exaggerating, suck it up, it'll go away, or whatever. You just want attention. You get all those. And so then there is the fear, and unfortunately sometimes it happens then, of the doctor saying, I really can't find anything wrong with you, or I really do think you're exaggerating because I see you have a mental health condition, may or may not be spoken on top of that. And so I'm just kind of wondering, just if anyone in the discussion has thoughts about how to confront that. I mean, I have to just tell myself, okay, I am going to see Dr. So-and-so. Dr. So-and-so is not my mother or my father or my whoever it is that, may have, traumatized me, and just be like, if I want them to give me a chance, I have to give them a chance, and I have to give myself this whole big talk about it. But there really is a fear of just being treated like especially if you have chronic illness, just kind of like, well, you have this illness and we've done everything we can for you. Sorry, you're still miserable. I mean, I have a friend in this position, but there's nothing else we can do. And they just sort of like, and then you're left where, like, well, then why did you make me come in here?
Yeah.
Just to take my blood pressure? If just to tell me that, sorry, I'm going to feel this way the rest of my life. I mean,
Yeah.
I don't know. I mean, so I guess I'm asking the provider community, since I just like to take advantage of this. I'm in a room full of a lot of
By all means.
what do you how do you, how would you like to be approached by a patient who feels like who you've been seeing for years, who was a quote complex case, that you feel like there's not much more you can do for them? What then? What should
I
we do?
think just saying that, being like, I feel like we've hit a dead end, and being just like really, and depending on your relationship with them, it could be like, hey, I know we've been working on this for a really long time. I just don't feel like we're progressing, or like we're just kind of pointing it out, that because sometimes in the midst, especially if you have a lot going on, right, there are so many different avenues that we're probably looking at, and we can get squirreled away into like one that we particularly think is important. And I think just refocusing on like, hey, like, let me bring you back to like what I'm also really worried about, and just say, like, what is our plan here? Like, I'm still really struggling with this. And like, I just don't know like where we're going. And like Nurse Scott said, there should always be a plan. So I think there's nothing wrong ever with anyone, even if you don't know your provider well, to be like, what is the plan here? Like, obviously, if you know them pretty well, you can be like, hey, we've done all of this. Like, what are we doing? If you were my patient and we've known each other, you'd probably be like, my knee is still like very painful. Like, what are you going to do about it? And I'd be like, well, actually, I don't know. This is maybe a time to like get an orthopedic, maybe get you a different orthopedic person. Maybe we should look into something else. Or, that's a good cue for that provider to reflect and be like, I need to get more help. You know what I mean? Like, what else are we doing next? But just saying, like, this is still a problem. This is still hurting me. This is still bothersome. And I just don't feel like I'm making the progress that I would like to make. And I can't do the things that I would really like to do. You know what I mean? And just bringing it up and making sure that they know that, hey, this is still a problem, because things can get buried on problems lists. Like, in the perfect world, we would all be very aware of everything. But especially if you have like multiple things going on, like I said, sometimes in your brain, you're like, oh, they haven't brought this up in a little while, so it's probably fine. When in reality, like, we should be checking up on it, but just bringing it back to the forefront and saying, hey, I haven't seen movement on this. I'd like to see more movement on it. What is the plan going forward? And if that doesn't work, then what are we doing? I like to usually know 2 steps ahead, and you can ask for 2 steps ahead. I love my patients who are like 12 steps ahead. They're like, and what if that doesn't work? I'm like, and then this, and they're like, and then what happens? I'm like, oh my gosh. Then this, like, no, like, try not to get too far ahead of yourself, because then you're going into like an epic branching tree of possibilities. But just, hey, what's the plan? What's the next step? And what are we going to do if that one doesn't work?
Yeah.
So that here's the road ahead.
Lisa was saying, ask for a specialist.
Yep.
So in the case that I'm thinking about, similar to my own, there are numerous specialists involved, and everyone is just sort of passing the buck to everyone else. And I mean, I guess that sadly, there are cases where sometimes you can only do so much, correct?
Well, that's a really good thing. I think we were talking too about before, is getting like a case manager. And you can either getting a case manager, or and depending on what kind of like, if you have if you're someone who has Medicaid or Medicare or private, what kind of insurance you have, either you can usually get one through your insurance. If you are at a federally qualified health center, usually they have care coordinators, and you can just get one. Like, they should already, usually with complex people, they give you a care coordinator, and that person's job is to sit at a table and get all the people around and actually present, which is one thing I love about federally qualified health centers, is you sit there and they literally present you to a table where everyone is sitting there and everyone in the office is there, and they have specialists, and they say, here's this case. I'm unsure where to go. and they have all the other people, they bounce it around and they come up with a plan for you. And they help you get there. Most insurance companies should have that. If you call and you say, I don't feel like I'm getting anywhere, do you have a care coordinator? Do you have a nurse? Like they're going to all call it different things, but just someone to help me coordinate this. We have hit a dead point. If you're a primary care person, or your team is all in the same hospital system, or even if they're not, we've talked about like just asking for a powwow and being like, I don't feel like this is going anywhere. Everyone, I would say, that is passing the buck off to something else, which is something that happens all the time. Urology is like, actually, that's a gynecologic problem. And the gynecologist is like, oh, that is a GI problem. Absolutely. And the GI person is like, their poop's fine. I'm done. And like, no one's discussing. And so either seeing if everyone's willing to get together, and we talked about like, you can get billable hours for that, or asking for a care coordinator and seeing like with your insurance or with the like if you're with a healthcare system, or if you're in a federally qualified health system, asking for your social worker and they will set you up. They're your like healthcare coordinator. So just kind of asking, your provider might know that, how to set that up for you, or you can call your insurance company and usually they will.
My insurance company won't cover it, and the social worker's job is more.
They do more of the social.
It's not to be involved long term. However, what I do is if I find someone to be really helpful, I always keep their name and number and what they did.
Yes.
And my number one resource right now is someone that called me like 3 years ago after I got out of the hospital, and I was just on one of those random lists, where they call and they've never met you and they don't know who you are. And they're just like, hi, we're just calling to see how you're doing. And I was like, well, actually, I have a really big problem. And they were like, no, they weren't really. That's just what I was afraid of.
They were like, that's not
and I had a problem, and the problem was unrelated to the surgery. Okay, so that was the thing. But I was like, I don't care. Somebody's asking me if I need help. I want help. And she did it and it had to do with care coordination and, communication between professionals. And now she's helped me like 4 times. It seems like every 6 months or so, I'm kind of like, hi, I have another problem. Do you think you could try to help me again?
Yep.
And, I don't know if that's technically her job or not, but it works.
Yeah. Yeah. I love that idea. Just find the helpful people and then bother them.
Yes.
Be like, hi, but be nice to them. And be nice to them and like, just be a decent human. And they'll probably be like, oh, okay. Like Melody's a delight to work with. And yes, I will go to bat for Melody. And then also just recognizing that the system is so messed up. Like it does not promote. It promotes sending people somewhere, having them fix a problem, and then sending you back, right? Like there's not a lot of collaboration, because collaboration requires people to admit that their specialty can't fix it. And what they really want to do is they want to get you there. And how they make money is by fixing it or sending you back. So if they can't do anything about it, they're going to turf you somewhere else. Like if they can't do a procedure or start a treatment for you, they're going to turf you to someone else, who's also going to look at it and be like, oh, this is very complicated. I saw this all the time as a primary care person. Was you had complex medical patients who came in and they just got bounced around and told a million different things and nothing ever got resolved, until eventually like you got hospitalized because it got so bad. And then you would get, it was just like an endless cycle. And this is a huge, huge issue. And it like, honestly, the best people I saw that were taken care of with it were people who had medical family members who like coordinated the crap out of those people's care. You know what I mean? Who understood the medical system, who like their, daughter or son was a nurse, and they were able to like go to all the appointments, understand all the things, advocate for all the things, do all the research. I have had so many patients who have had to research everything for themselves and be like, look, friends, I'm putting this constellation together and I actually think it's like this might be going on. And it's hard. And it's hard, like, primary care, we're not the best at it. A lot of times it's so big that like you don't have the time. Like in a perfect world you would, but like it's just hard to see the whole picture. It's a mess. It's a mess. So I just want to acknowledge that too, that there's no perfect like, oh, well, why don't you just contact your case manager? Because a lot of times either if you don't have one or it just doesn't work the beautiful way we would like it to. And so if you're experiencing that too, like know that that's very real and it just stinks. You're not doing it wrong. The system stinks.
It hasn't
Absolutely.
been my experience, but I've been repeatedly told that palliative care is supposed to assist with this.
Yes.
Do you guys
Oh, I'm
have
glad yes.
feedback?
Yes. So palliative care, I think is highly underutilized. And so palliative care, if you're not familiar, is just whenever someone has a life limiting chronic disease. So something that is going to affect them or like that's just going to affect them for the rest of their life. And it is not going to necessarily like get better. And it is causing just like difficulties. You know what I mean? Something that is chronic enough that it's causing harm. Palliative care is an excellent coordinator, and this is not hospice. Very oftenly you bring up palliative care with people, and if you are having that conversation, that should be the next thing out of your mouth. I want to have a conversation with you about palliative care. This is not hospice. I'm not telling you you are dying. This is a conversation about quality of life and how we can help you get those resources. Okay. Do not ever, having made that mistake, be like, I want to talk about palliative care. And then I go on my speech and the person didn't hear anything. They're like, I'm dying. I'm like, no, your leg was amputated. Why would you be dying? And they're like, you said palliative care. And I was like, oh, oh. So having that conversation, but they have all the connections. They know, like Melody said, they know all the people who can call and get together, and they're going to combine everything. They're going to know the people who are going to just make your life more comfortable, and they can be a very good voice in advocating and kind of sending you in a mission or in a direction. Yeah, Clayton, palliative care is so underused. Lisa said palliative case care is an amazing resource. Yes, get to know your palliative care people and send people there. My palliative care people probably hated that they met me because I was like, hi, I'm going to send half of my practice to you.
So does palliative care do like care coordination, or do they actually potentially offer treatments that your other doctors otherwise may not have had access to?
I think it probably depends on the palliative care group. The ones that I have worked with before, they actually kind of like looked at the whole thing and said like, hey, they coordinated it a little bit. And they said, hey, I think this might be going on. Like, let's look here. They didn't actually run diagnostic things because again, their goal is to make life just like a little bit easier and provide quality of life, right? So they would sometimes like kind of coordinate, and just be able to go in between and be like, hey, why are you saying this? And then cardiology is saying this. And then like kidney people are saying you can't do any of that. Like what is happening here? But they couldn't actually come up with a plan to say, hey, this is what I think we should do. Maybe they could recommend it, but I think it'll probably change by your area. And like Lisa was saying, there's no palliative care in our area, but our hospice is looking at expanding. Care coordination aspect is quite similar. So it probably just depends on where you live, Yes, my mom loved the palliative care my grandma received when she was going to pass away from cancer. Sophia, yeah. Palliative care is like, I interviewed someone who worked in palliative care, and I was like, if I ever go back into practice, I am going into palliative care because that seems great. Not great that you have to work with people who are obviously suffering, but like you can actually do good. Mira, oh hi Mira. Mira's the one who we just interviewed for the video that went up yesterday, the pre-PA school interview. So if you're interested in becoming or contemplating going to PA school, go watch that video because Mira gave all the deets about PA school, which is wonderful. And yes, facts. I want to work in palliative care as a PA. Yes, please do. Go change the world.
So then can you give me some examples of things that palliative care might offer to help someone improve their quality of life?
So our palliative care would get people hooked up with like, hey, we will help you get a gym membership to a gym with an aquatic center so you can go do water or like aerobic Zumba. That's going to help you breathe easier. We're going to coordinate with the home health agency who's going to be shipping you your oxygen containers so that you don't have to now contact the medical equipment company. We are going to hey, you should probably have physical therapy. You probably need home health. Hey, did you know you can actually have someone come to your home and clean it, and your Medicaid or Medicare will actually pay for that because you have X and Y going on and you can't move. Like, just all sorts of things that you don't even know existed. Like, I had no idea. And then I would send people there and they would be like, oh yeah, someone went grocery shopping for me this week. Like, they do that now. You know what I mean? Like, where I had no idea that that was even something that I could have happen for my patients, and palliative care did know. So, and they can sometimes get involved, in, hey, your pain doesn't seem well controlled. Here's how maybe we could get you, advocate for you to go in this direction. So basically just like super duper helpful. And Jessica said, hi, I just learned you're live. I'm a palliative care NP. Perfect. So Jessica, if there's anything that, thank you for being here. If there's anything you want to add about what you do, and one day, if you want to let me pick your brain, be on this channel, we would love to talk about palliative care, because I think it's something that is incredibly, incredibly underutilized. Palliative care and hospice are different technically. Yes. So they are like adjacent. They're like neighbors that kind of share a wall. That's how I describe it. One kind of fits in the other and they kind of share a little wall. Anna said, I begged palliative care to give me help for quality of life to extend, and they were offered nothing because they have specialists and they can manage. Well, that's the worst. And I am sorry, because that is, I think it just depends on practice, but, I'm laughing at Scott's comment. That's the worst, because palliative care can be so much more than that. And I am sorry. Amira said you cannot be terminal, but you can be non-terminal, so then you can get palliative. Yes. So a good example of like palliative care is heart failure patients. It's going to impact your quality of life, really bad COPD. I have had a lot of patients who are just like have mobility difficulties, who are, have a hard time seeing. Like, you can really get it for quite a lot of things. Did that answer your question in a very long-winded way?
No, it's good. That was not my experience or Anna's.
It sounds like that. And I'm sorry. Yeah.
So I wanted to see, what else was out there.
And it can be positive, and I'm really sorry that yours wasn't. And I know there are not a ton of palliative care people. So if you live in an area with a crappy one, you're just kind of like, it sucks because you're just kind of screwed, because palliative care is very localized, because they have to be very much in contact with home health, they have to know the social work. They have to know what your city offers. They have to know. So like, that's not something where someone else, we might be like, hey, let's just have you go to the cardiologist that's like an hour away, but is still in network because he's or she is very nice. But you know what I mean? With palliative care, it's like so different. Scott was saying, oh my gosh, as soon as Jessica commented, I'm like, Liz is going to make her a panelist. Yes, welcome. That's our goal. We're just trying to include everyone. I'm like, I'd like all the opinions. Let's go. Sophia knows me well too. There it goes. Anyone who comes on my channel is like, hi, I have, I feel passionately about something and I have some experience in it. I'm like, yes. Yes. And then Melody knows I never leave them alone. I'm like, you want to come again? Wonderful. Come again? You want to come again? Let's keep talking. Hopefully you guys are liking the panelists, because I am. And I keep employing them. I keep having them come back. Yes, different mindsets. Perfect. Oh, good. Jessica agrees. Thanks. Perfect. Jessica, email me. Second opinion. Can you put my email in the chat? Perfect. I think I accidentally deleted your comment. Did I? Oh, no, here it is. There we go. Pain management physician can have a form and put you on palliative care too. Perfect. And she already did. Awesome. Perfect. Anything else that you definitely want to talk about, Melody, before we go back and just answer some questions? Or turn into, hey, ask Melody anything.
Not
within limits.
I reserve the right to remain
silent. Exactly. I plead. No, that's.
No, I think we've pretty much covered it. I guess the one thing I already asked, but I'll come back to it just to bring it back, is when you are at the point with a patient where it really does seem like there's nothing more that can be done, Does it fall more then into the mental health treatment in order to come to some sort of acceptance of that? Or is that still more part of the medical provider's job?
So I think it can be both. I think it can kind of be something that you really can go to your mental health people. And like you said, when you have a chronic condition, there is pretty much going to be like that is difficult to come to terms with. And so I think it can be a both where you're kind of like even just venting like I am frustrated, I feel like there are no answers. Um can we just start talking about coping strategies to help me figure like just deal with this? Like, what does this look like going forward? Getting palliative care involved, I think, I mean, yours was awful. So I guess that's not a very valid solution. But like in a perfect world, getting palliative care involved and saying this seems very dead end.
Mm-hmm.
And then seeing like trying to get someone like see if you can get anyone to advocate for you and get you a different opinion or different eyeballs. And this is where it gets really hard because this is where people start to leave and they go and get second opinions, but that is something that is insanely expensive because usually when your insurance sends you down this funnel and it's like, hey, well, this is your cardiologist, this is your rheumatologist, this is your you have these three choices, and then the healthcare system's like, well, I don't really want you to switch, like this is your choice. So then you have people who go outside of that and they say, that's fine, I'll pay out of pocket, I'm going to go to the Mayo Clinic, I'm going to go to somewhere that specializes in this type of thing, and that is usually out of pocket and wildly expensive. So, other than kind of coming together and saying, hey, I really don't feel like this is going anywhere, what are our next steps? And hopefully, someone will be like, hey, let's just try this or let's look into this. Really researching, like having to become your own advocate, which stinks, and like really researching it, going through it, having someone else help you with that, and be like, hey, can you also look at this with me, and help me parse through some of this to give it like direction, or if anything seems relevant, asking for a social, like a case manager with social work. And if anyone else has any ideas, but those are the big ones that I can think of how to kind of get help.
I think that the mental health aspect is very important
Mhm.
because, particularly if you're being diagnosed like in your 20s or your 30s,
Yeah.
and you're in the middle of your education or your relationship or whatever, and you thought you were, I mean, like me, I went through all this education and then I went through a year of
Yeah.
law school and then I almost, anyway. So,
Oh,
but and eventually I was like, you know what I am trying to do here and what I want to do is not realistic given my condition, and just
yeah.
having some sort of help. And that's a grieving process of
Oh
like the
my
life that I
gosh. Yeah.
wanted to have and thought I was going to have. And it's so hard though, because there's this line between like, well, am I just giving up? Should I be trying harder or fighting harder? Or is this like, okay, this is acceptance. And so I have to reroute things and, and
Yeah.
replan. I just think that that's something that people with chronic illness really need to address
For
somewhere.
sure. Yes. Yeah.
But
I
to
think,
do that, you need accurate and realistic information from your medical providers,
yeah.
and then take that to the mental health provider. And it's hard to get any providers anywhere right now with the shortage. So I feel a little
Yeah.
helpless because it's like we can talk about all these resources and seeing a specialist, and then you call and you try to get into the specialist and they're not even taking a waiting list,
Yep.
or the waiting list is 3 years long. And
Yep.
so I feel like I don't want to. I'm trying to come up not only for myself and people in my life, but for your audience here. I'm just trying to come
Yeah.
up with like, what can we do given the healthcare crisis that we're in? and
Yeah.
and really the only thing I can come up with is talk to each other.
And I've had a lot of patients that get a lot of answers or direction from like like Discord servers or Facebook groups where they'll be like, and they'll be able to come in when we're kind of like at an impasse. Like I've had a lot of patients who could not afford to go to a specialist, like just could not afford it. And we didn't know which way to really like go. They're like, I can go to one. And we're like, okay, well, I don't know. Like I don't know which one, and me and my, like, I've consulted the physician I worked with, and like we've called all these specialists and they're all like, well, we really need to see her. And then they would go on the Facebook page and they were like, those could be so helpful. Like, cause it really could point them in a direction because they talk to each other. You know what I mean? And they were like, oh, like this, you like your web is so much bigger that way. And you find that one person who's like, I actually have all of that. And like, this is what I ended up having, like, and seeing. And so I think a lot of the internet gets poo pooed on for like, oh, you're like crowdsourcing your healthcare. Well, yes, because the situation that we are in is not working. Um, like it's not working. You know what I mean? Like you said, you're on wait lists for years, like years. I would have patients for rheumatology and the wait was like 18 months. And I'm like, well, okay. Okay. So what until then? And then you have a 15-minute appointment and then what? You're going to see them again in a year. Like this isn't working. So crowdsourcing is kind of where we're at. And if you guys have any other ideas in the chat, let us know because it's infuriating. Like that was a huge reason I left and I wasn't even the one in the situation. So I can't imagine being like someone in the situation, like how you must feel. You know what I mean? Being the person affected. I just saw it so much that I was like, I can't do this. I can't see this many people like not having answers. You know what I mean? Like, so I hate it.
I feel that way about the mental health shortage too, because like I tried to get in and the standard now is like, well, you can be seen every 3 weeks. Well, I can't work through anything in 50 minutes every 3 weeks. It's like you're ripping off a Band-Aid. I'm going to bleed for 3 weeks. And, I mean,
Yep.
that's dangerous for me. And that's why I went to an alternative form of therapy.
Yeah.
But
yeah.
Unfortunately, I was able to do that, but not everyone can. And it's like, I want to be an advocate, but I don't want to give advice that I know like was practical 10 years ago. But these days, all it's going to do is people are going to, call the 1-800 numbers and get discouraged.
Yeah. 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 It stinks. And I hate it. Can you tell us the name of your cat as a mild break?
Oh yes. Is he making an appearance? Well, I know his tail has.
Anyway, his butt. Yeah. It was making a very nice. It's very
his
nice
name
and
is
fluffy.
Raymond after Everybody Loves Raymond.
Yes, I love it.
Yes, and one time I had a neighbor come to my door and ask me if Seinfeld was home.
I love it. I love it. Wow. Anna said she was on a wait list for 4 years to see a geneticist. That is a lot. Yeah. One day we should do a chat about like more of just like a crowdsourcing complaining time of wait times because it's impossible. It's literally impossible. Like I would have people who were coming in very in crisis in a mental health thing and there were no hospitals that could take them and a psychiatrist wait was like 12 months out. And you were like, well, what do I do? Like literally what do I do? And it's a mess. And then your insurance a lot of times is like, well, you can have therapy 6 times a year. And you're like, wow.
Thanks.
Right when I dive in and find out, right when they're like, here's all your issues. And you finally get into it. And then they're like, but good luck. Good luck. And that's why I feel like a lot of people are resorting to online therapy. Yeah. And even that is so expensive. So expensive. Trisha Jackson, I went to therapy. It was twice a week at the beginning, then once a week for the following 3 years. That's what I need. That is what I need. Very, very much. Okay, let's go back and see some of these comments. And then if you guys have a question for Melody, we're an AMA, ask Melody anything. Okay.
Oh my goodness.
We won't have it last terribly long. So we'll cut off probably in 12 minutes. Okay. 12 minutes. So ask Melody anything within reason. And Melody has all the power to just plead the fifth and move on. Let me see. Okay, good. We talked about Mama Nurse saying when we don't wake people up without asking them.
I saw that was cerebral. I investigated I looked into them and they kept sending me all these emails that like, well, your first month will only be $40 and then it was only $20. And I figured out that it was a scam just because they didn't even let me reply before they started trying to sell me their service. It was weird.
That is, I don't know a ton about cerebral, but I do know it's making people like, I think, is that the one that's making it really hard for people to get ADHD medicine? Like, it's created a shortage for it or something because so many people are getting like
Oh my goodness.
diagnosed with ADHD and then they couldn't actually get like extended release Adderall or something. Like that might be something totally different, but yeah, those things I see the need for them, but like also yikes, like because it's a
The
business.
um what's it called? The one that Dr. Phil is always promoting his.
Oh God,
No, okay, you may not like Dr. Phil, but I looked into his program. It's like MedMD or something like that.
I don't
And
know anything about it.
it really is legitimate. They take most insurance. You have to schedule like maybe 3 or 4 weeks in advance, but once you do, you can see someone regularly.
Oh,
That one is legit, just so you know. I checked it out.
all right, Dr. Phil. All right. Nurse Scott says doctor on demand.
Yes,
I
thank you.
used
Thank you.
oh yes, that is legit. I used Doctor on Demand today to have my arm dealt with, and I really liked them. They were great, and they do have psychiatric things.
Yes.
And yes, that
They're
is
all
actually
PhDs. All their therapists are PhDs.
oh, that's awesome. I was actually looking at that today because I was like, oh, I could maybe schedule myself. I was trying to go to a psychiatrist, and that was 16 months out, so I just didn't bother. I was like, I'm not gonna no. Um, so yes, I will dive into that for all of us. I will be the guinea pig. But they did a great job at helping me with my poison ivy rash, and that I'm sitting here like scratching like crazy. I'm like, I should probably be on steroids. This itches everywhere. Um, very nice, very convenient, and I'll
Nurse
try out
Scott
this.
says Teladoc. I haven't heard of that one.
Yeah, Teladoc is another one. It just depends on your insurance, which one they usually cover, um, and we'll see. My insurance offers Teladoc, said Peggy. Yeah, your insurance will tell you. Mine covered Doctor on Demand, and it really was quite great. I appreciated it. Let me see. Other people sharing their stories. Anna said, I was told I went to the ER too much. I went to the ER too much when I had gone there for cellulitis on my port, passing out 5 times anaphylaxis and using 6 EpiPens in a week and then sepsis. And they made an ER plan for me. I had to advocate through medical PTSD in order to fix what this doctor had done. I am so sorry. That is a mess. The amount of people that just don't listen, you know what I mean? Like, we're going to change the world, friends. We're going to change the world. Everyone's going to watch this video and be much nicer and more compassionate. Okay. That's the goal.
Thank you for sharing, Anna. She doesn't usually share, so you're doing a good job, Nurse Liz, because she feels safe here.
I appreciate you, and I appreciate everybody who's shared. I know it's not easy to talk about, but I appreciate it. I think giving it helps other people to realize they're not the only ones who are also dealing with things, and it also helps providers realize, wow, this is a heck of a lot more common and doesn't all look like, hey, I experienced like, most people, they really do just think of like physical, some type of abuse or like something, you took my uterus and you didn't listen to me. You know what I mean? Nurse Scott said, years ago, I was transferred in the middle of the night to an hour away with the clothes on my back for a mental health issue. It was extremely disorienting. I still don't know thinking about it. Trauma doesn't have to be full on PTSD. Exactly. Exactly. Yeah. It can be anything that makes you be like, I don't like this. I don't like it.
I started a trend at the hospital unknowingly. Nurse Scott, I shared, I think before you logged in, but at the beginning I had to be transported an hour and a half away for a procedure, and with the clothes on my back and my purse, and that was it. So I got on here, it's called Instacart, where you can just have a store deliver things to you, kind of like Uber Eats, only regular stores. And I ordered a fuzzy blanket and a fuzzy pillow. And I just like told the nurse, I was like, by the way, somebody's going to come in here like from a delivery service with a pillow and a blanket.
Oh, that's a good idea.
And the doctor liked it so much that he went around telling all the patients, if you forgot anything, we have this patient that got on Instacart. And it just became this whole thing.
That's a really good idea.
Because I was scared and I was too far away from home for anybody to bring me my teddy bear.
Yeah. I like that idea. I feel like we could like start that as like a fund, like a fund or something. You know what I mean? To like give people like, hey, here's $100 Instacart gift card
Right.
for when you're in the
Comfort,
hospital
comfort
and you're just
items.
like, I need Cheetos.
I was like, "Do you have a gift shop here?" They're like, "No, it was closed because of COVID." And I'm like,
Well, then I
"Help!"
will have it delivered to me. Watch me problem solve and advocate for myself. Okay. And Clayton said, thank you for what you do, Melody. I always say if you can bring someone with you, even better if they're medically educated. So this was going to an appointment with someone so they can advocate for you. That's what I do now. Is a pain patient advocate. Oh, well, thank you for what you do because that is a world of oof.
Absolutely.
A world of oof. Yes, Scott said, how did we as an industry forget kindness? We made it about money, Scott. We made it about money. That's how. And we put people in charge who hate people and love money. That's how. I love my first hospital's motto: skills tenderly applied work wonders. I love that. That's very
Mhm.
nice. I like that. Okay, let me. Oh, I hit a button. Go back and see. Scroll down. Scroll down. I wish they had Instacart 20 years ago. Me too. Yeah. Could I have used Instacart 20 years ago? I can't math. Yes. I think yes. Instacart's great. I love Instacart. Sophia said I use Doctor on Demand, but it's pricey. I've been using telehealth through my insurance. Yes. I use Doctor on Demand because my insurance had it be free. So, because it must be cheaper for them. The only reason they would make it free is because it would be cheaper than me to go actually to urgent care. So, whatever, some insurances will cover it for like free or a lower price, and look there. And if you have that, that's a great, great option. Clayton said that's nuts to have to wait that long for a psychiatrist. I agree. I agree. I agree. I agree. Yes. 2002. Yeah. I was in high school, I think, in 2002. So I could use Instacart. Totally fine. Let me go back up. Do you see any questions, things you want to answer? Oh, my sister just said I was 13, 20 years ago. Thank you.
This
Somebody did
was
not.
our Melody.
Love your bids. If there's
I've
time,
got
I
a
haven't.
question. Yeah.
Totally fine.
News
There's some
reports.
there are some news reports like the ones on CNN that nursing schools are heavily impacted right now. Is this true? Impacted by what? By what? Impacted by
I
what?
do know that there's a shortage of nursing teachers, at least
Yes.
in where I am in Wisconsin. And so
Yes.
that is restricting the class size and the admissions to the nursing programs.
Yes. Because we don't pay them. So what a big problem with nursing education is, which has been a problem since I was in nursing school because my teachers complained about it then, is they don't want to hire teachers on as like full time. They want to just do adjuncts. So you basically can just pay them a lot less, not give them benefits, not do all the things. And they pay them like absolutely horribly. So that is a big problem. And then and then you have nursing instructors who get in there, and the ones that are like the full-time ones are rough and not the best. And they've been there a very long time. And they pay really crappy. Yes. And we've had a shortage for decades, and it's the worst. It's not fun. Not fun at all. But yes, if there's other things, nursing school is kind of a hot mess, but we can talk about that at a different time. If you like, I have enough for like 12 million live streams on how much nursing school is a mess. We did do one recently on Indiana
I saw
nursing
that.
school, just kind of eliminate being like, oh, wow, there's not enough nurses. It's fine. We'll just make nursing school easier and reduce all the requirements for it and just make it a mess. And it's like, oh my gosh, what a mess. Perfect. Okay. I think we got everything. I appreciate you, Melody. You're a trooper. And
Thank
I
you.
very much appreciate you being willing to come on here and just like share and be very vulnerable and open with that. I think it's going to hopefully help a lot of people to just reconsider it. And like you said, just kind of go into it, assuming every single person has some kind of like trauma, and just be nice to them, be kind. from a provider end and from a patient end, a little bit of vulnerability and just like letting people know a tiny bit of where you're coming from. Most people in healthcare, not all, but most of us did go into it to in some way help people. And everyone just doesn't necessarily know how. And they get kind of stuck in there like, oh, everyone's totally fine, and has had the exact same experiences I have. And just kind of speaking up um, and protecting your mental health surrounding it too. And not being afraid to be like, oh, like your mental health is a big deal. You know what I mean? And not being like, oh, I don't want to, bring this up or talk about how this is going to affect that because it's very important. And if your mental health isn't functioning very well, you won't function very well.
Well, like I said, I just find it easier to be in control of the situation, of the conversation, than to just let them assume whatever they want.
Yep. And take charge of it. Yeah. And call it out. Be like, I know you're probably, without being it, because like what they're probably thinking is, oh, yeah, this person has X, Y, and Z. And just being like, hey, I know.
Yeah.
I know we're doing this. Like, let's tackle it together.
You're welcome, Clayton. I just want to let you all know if you think of anything that you would like to ask me. I think you might put my contact information, but the other thing you can do is comment on the replay. I do read the comments, and if you, well, kind of whether you ask me to or not, I will reply.
I love it.
I did on the last one. I had fun. So
oh, I love that.
That's another way to reach me. I figured it would help boost your algorithm if I just answered everybody.
Why, thank you. I appreciate it. Melody, you're coming on to everything. This is amazing. Awesome. And if you did like this video, stream, everything, do please perform compressions on the like button or the subscribe button an odd number of times. It very much helps the vital signs of the video and tells YouTube that you found it helpful, and other people should also watch it as well. Melody, would you like to, I will list your, it was Twitter, right? That you have?
Mm-hmm.
I will list your Twitter down below. Anything else you want to plug, promo, anything like that?
Well, I do have a YouTube channel. It mostly has to do with my music therapy.
Love that.
If you just type in Melody Nolan into YouTube, there's two of us. You can tell which one is me, and you can do it. And just so you know, the music therapy videos that actually call Melody's Music Therapy, those are from my actual music therapy sessions. So they're not rehearsed. They're not meant to be high quality recordings. They're just meant to be expression. But if you go to the other lists of like my actual recordings, that's where you will actually get high quality music. So don't judge my voice based on the music therapy sessions.
Because that's what we were all going to do. We were like, you know what? I am going to go critique someone. But there are people out there who are like, you know what I'm going to do with my day? This person obviously trying to do nice things with music therapy. I'm going to go critique them. Tear everything apart. You're like, what is wrong with you?
I just started it maybe like almost 2 months ago again, after having been off for like 2 years. And so I don't have all my strength back yet. So I just don't sing the way that I used to. But I decided, my music therapist says music therapy is not about performance. It's just kind of hard because I have a background in music. So I tend to.
You're your harshest critic.
And so I'm like, okay, this is an exercise in releasing perfectionism.
Yes.
What comes out comes out. And
I love that. Yes. Everyone go check it out. We will leave that link down below too. And it is linked right now in the chat if you want to go check it out. And I love that. I think music therapy is so helpful. We'll have to do a thing on that at some point, and like benefits of that type of stuff, because we did music therapy all the time in peds and it was so helpful. And they did not hold themselves to any bar whatsoever. Let me just tell you.
Well, like I said, you may want to address it because that video I was in has your channel plastered all over it and people are going to want to know why.
Yeah, Melody very kindly advertised for me on the interview that she was on that we'll show one day here. And the clip they brought out was for music therapy people who now think my channel is probably for music therapy. And then they come over and they're like, this girl's really angry about nursing things. Like, what happened to this music therapist? Like that she has so much angst for nursing. It's fine. It's fine. Everything's going to be totally fine. Everything's going to be fine.
Norma Cantor. Why does that name sound familiar?
She's the mother of expressive therapy.
I'm writing it down.
Perfect. Norma Cantor. That sounds like someone who would be like in charge of expressive therapy. Like, hello, I'm Norma Cantor. Join us today.
And you have a new subscriber from Nurse Corky.
I think she subscribed to you. Nurse Corky and I go way back. Yeah.
Thank you.
Subscribe to you. Nurse Corky, if you're not subscribed to me at this point, we have words. But I'm pretty sure she subscribed to you.
Thank you. I appreciate that.
Was a dancer.
Oh, a dancer.
Oh, I love that. That's super cool. So we can check out her too, because I think there are lots of other ways to.
Thank you, Lisa.
Like, yes, therapy other than words, because a lot of us struggle with words coming out. And yes, other modalities are very, very helpful. Very helpful. All right, friends. I appreciate you being here. If you like these conversations, like I said, like them, share them. We will be, yes, Nurse Scott, be sure to catch another live panel discussion this Thursday at noon Pacific time, 3 p.m. Eastern time. Topic tentatively is going to be like advice for people who are going out into nursing now, who are scared because the world hates nursing. And all the nurses seem like they hate it. And like, would you do it again? Essentially, that's tentative. We'll see where it goes. We were going to do one about discussing weight, and I'm not sure if I want to do that one. I don't know. You guys let me know. I think I want to do that one maybe by myself, or maybe with people who have experienced things with it. I'm very protective of that topic. And I love all the panel people, but the panel is to get lots of different insights. And I'm not sure I want that to be a very certain conversation. You know what I mean? I haven't figured that out yet. So that's just kind of the background of my brain. So I know we had talked about doing that this Thursday, but we might wait and like see. You guys let me know. Maybe we'll do a poll in the community tab.
It seemed really popular in the comments that people.
Yeah. And so like how we want to do it. So like, do we want to do it with like everybody's input? Do we want to, like, Lisa, I saw you were saying you would be willing to do it. There's Scott, I get it. And like, just kind of see, you know what I mean? And go from there. But Lisa, if we're not already in contact, do you want to be on the panel? Be sure to email me. I would appreciate that. And it would be very helpful. And yes, I think other wrapping up-y thingies, if you want to become a channel member and get a cool little thingy majiggy by a code red by your name, you start as code brown. We all start as poop. Okay. Every channel member starts as code brown, and get access to random other videos. We do I'm starting to do a lot of reaction videos live. You can join these lovely humans and become a channel member. Thanks to these people, or just subscribe and share and like and do all of those things. And it also improves the vital signs. All right, friends. Thank you very much, Melody, for being here. I feel like this was a very Midwestern goodbye. We've been slowly winding down. I did live in Michigan for a while, so it makes sense. And yes, I hope you remember that you, my friends, are not alone. You are more than enough, and you can do hard things. Bye, friends.
Bye. Thank you.
This one day I'm going to find this button and it's going to be quicker.
That's pretty.
It is. I tried. I went to Canva and I typed pretty pink rainbow swirls.
Really?
Yeah.